Hello everybody, I'm Bill Connors with Aphasia Toolbox, and we're talking about outcomes that truly matter. At Aphasia Toolbox, we strive to make sure that the client goals, the goals that you bring to us, drive our treatment process and your practice. This means that we revolve everything around what you want to accomplish in the long run. I learned long ago it's not my job to tell my clients who they are or who they should be. But rather, as a rehab specialist, I work hard to maximize my clients' recovery, to optimize their skill so they can best accomplish what they want to do to get their best outcomes. I think it's important that you let your speech-language pathologist know, if you're in treatment, what your long-term goals are, what you want to accomplish. So the therapist can then explain how her treatment plan will help you achieve your goals. We speech pathologists appreciate the important role that your needs and your values have in what we call evidence-based practice. As you read our newsletter, you're going to meet 4 clients who approached me with rather lofty goals. It's almost scary as a therapist as to how I'm going to help them get there. But you're going to read and see what they've been able to do and what they're still doing. Outcomes can mean different things to different people. To researchers, it might be data to draw conclusions. To a speech pathologist, it might be documentation of your progress. To an insurance company, outcomes might be statistics to show value that they're getting for the dollars they spend. So, the outcomes that a person with aphasia may have then tend to be very similar among clients. What do people recovering from aphasia really want? Well, they want to converse. They want to have conversations. They want to chat with their friends over coffee in Starbucks. They want to read stories to their grandkids. Our clients are even using Skype to read stories to their grandkids in different states in the United States. People with aphasia want to use technology, the internet. So we have our clients emailing in a normal fashion very early in our therapy. People with aphasia want to interact with screens. In other words, use ATM machines and pump gas and pay for things with debit cards. People recovering from aphasia want to discuss things with their spouse or their partner or their caregivers. So what do these sort of have in common? Normal. People with aphasia want to be as normal as possible. Maybe that's a new normal. But we can't be afraid of the fact that people with aphasia are used to being normal, and that's something that's an outcome that's often on the back of their mind. So let's take a look at some recommendations. My advice is to decide on your outcomes early, realizing your outcomes may change, and stay with that. So keep your focus on what you want to accomplish, and then find the kind of help in terms of therapy, physical trainers, caregivers, coaches who are of like mind and kindred spirit. Remember to use a whole person recovery. Work on your nutrition, exercise, spirituality, whatever it is that's important to you. And finally, never give up. I hope you enjoy this July 2014 edition of the Aphasia Toolbox newsletter, edited by Sharon Renhack.